Hi, I'm Charlie, and together with Adam and Kyle, we're the team behind Help Me GMP. Our mission is straightforward: to give you clear, free training on GMP, GDP, and all things compliance. No fluff, no jargon. Just real knowledge you can put to work in the pharmaceutical world. Today we're looking at a role that's absolutely critical for any company that supplies medicines under a wholesale distribution authorisation, or WDA, still sometimes called a WDL. There's also two types of authorisation: one for human medicines, which adds an H to the WDA, and one for veterinary medicines, which adds a V. Both types of WDA require a responsible person, usually shortened to RP, to take on key legal responsibilities. In this video, we'll cover what the RP does, how the role compares with the head of production, the head of quality control, and the qualified person on a manufacturer's license, and why the RP is so central to the safe supply of medicines. Let's get into it. Let's start with what is a responsible person and what do they do. The RP is a mandatory, named position on every WDA. Their mission: make sure every activity linked to storage, distribution, and supply of medicines follows good distribution practice, or GDP. GDP protects the quality and integrity of medicines after they leave the factory until they reach the point of care. The RP is legally accountable for that protection and must keep the supply chain secure, compliant, and traceable. Their key duties include maintaining a fully functioning quality management system, planning and evaluating self-inspections and internal audits, ensuring medicines are stored and transported under the correct temperature and environmental conditions, approving or rejecting suppliers and customers, handling complaints, returns and recalls, being continuously contactable, or having written controlled delegation, ensuring the security of the supply chain is maintained throughout the storage and distribution lifecycle. You may wonder how the RP compares with other manufacturing roles. Under a manufacturer's license, you normally see 2 to 3 senior posts. The head of production, who is accountable for how the product is made, ensuring manufacturing is performed under controlled GMP compliance conditions. The head of quality control, who is responsible for testing and confirming the product meets specifications and managing the quality system in a pharmaceutical manufacturing site. And the qualified person, or QP, is a legally separate named individual who certifies each batch before release. In some firms, the head of quality control is also the QP. In others, the roles are split. All three are named on the manufacturer's license, just as the RP is named on the WDA. Here's the key differences. GMP roles protect the product inside the factory, making it correctly and releasing it only when it passes every test. So, what background does an RP need? A solid scientific or technical background. Pharmacy, life sciences, chemistry, engineering and similar fields are all common. Documented GDP training and ongoing continuing professional development. Hands-on experience with distribution operations and quality systems. The authority and the confidence to make tough independent decisions that put patient safety ahead of commercial pressure. The MHRA expects evidence that the RP is truly active in the business, present in audits, deviation investigations, temperature excursion reviews, SOP updates, CAPA follow-through, and change control boards. What are the common mistakes companies make? The RP is on the license but not involved in day-to-day operations. No robust traceability or temperature monitoring system. SOPs are out of date or don't align with GDP. The RP is left out of deviations, recalls, or change control. Training records don't demonstrate ongoing GDP competence. All of these raise red flags for inspectors and put the WDA at risk. The RP needs real authority, visibility, and empowerment. Why does this role matter more than ever? Complex global supply chains, the rise of cold chain biologics, counterfeit medicine threats, and stricter data integrity expectations all make the RP indispensable. Think of the QP as the gatekeeper that releases each batch into the market. The RP is the guardian that protects those batches in the wild. Whether you're already working in distribution, thinking of becoming an RP, or a production or quality professional, mapping how these roles connect, we hope this video clarifies the similarities, the differences and the day-to-day importance of the RP. I'm Charlie. And on behalf of Adam, Kyle and the whole Help Me GMP team, thanks for watching. Remember, GMP protects how it's made. GDP protects how it moves. Both protect the patient. If you found this helpful, hit subscribe and let us know what you'd like us to cover next. Stay safe, stay compliant. See you next time.